You ready? Okay. Welcome, ladies and gentlemen. This is Cuyahoga County Public Safety and Justice Affairs Committee meeting. Roll call, please.
Calling the roll, Mr. Gallagher.
Here.
Ms. Conwell.
Present.
Mr. Tuma.
Here.
Mr. Jones. Mr. Jones is absent at the moment. Ms. Simon. Ms. Simon is absent at the moment. There is a quorum.
Is there public comment?
No, Mr. Chair, no one has signed in.
In your packet, we have the minutes of June 29th's meeting. If they're in order, I'll accept the motion in a second.
I'll make the motion.
Second.
Any further comment? All in favor?
Aye.
Against? Thank you. Resolution 2021-0167.
Resolution number 2021-0167, making awards on requisition number 2470 for a master contract with various providers in a total amount not to exceed $1 million for traditional residential treatment services for the period 2/1/2021 through 1/31/2023.
Who speaks for juvenile?
Good afternoon, Sarah Baker with Juvenile Court. This is our master contract for our traditional residential treatment services. We did issue an RFP for this back last year. We actually sent the bid out to 55 vendors and received 15 proposals back, and we're now wishing to contract with 10 of those 15 that came back in. The folks that we chose not to contract with were more so due to distance. We had a number of folks that were in Iowa. We also had another vendor that was in Nebraska. And then we had vendors that also applied that we have contracted with in the past that we did not have good results with in the past. So those were the reasons why we did not choose the other 5 that also applied. Most of the vendors that we are going forward for this term have asked for an increase in per diem. So we are increasing the per diem rates as well. So this will be for a 2-year term. And then we've also invited our director of programming to kind of talk about the last contract term and the services that we do offer and kind of the amount of referrals that we do and looking at our recidivism rates for residential treatment.
Thank you.
Good afternoon. I'm Bridget Gibbs. I'm the Director of Programming at Cuyahoga County Juvenile Court. All of the programs that we contract with, youth are selected by going through specialized committees. So we do what we can to specialize and ensure that youth are exhausting community-based services, such as intensive in-home family therapy, substance abuse treatment in the community. Our committees help guide the selection of the appropriate placements. All of our placement programs utilize cognitive behavioral therapy as sort of the foundation for their treatment delivery, as that's been the most effective in impacting kids with criminogenic thinking and other risk factors. The average length of stay is about 160 days. Our recidivism rate is every facility is vastly different than the others, so they're between 30 to 40. We do have some that treat some of our very highest level offenders who have a recidivism rate of 50%. Majority of youth complete the program successfully. We have various treatments. Most of them are in Ohio or neighboring states. Most of them are staff secured, which means that they are not locked down. We do have a couple of secured facilities for our kids that require that level of intervention. But again, every kid receives family therapy. That's all been performed through telehealth, individual therapy, and at least 10 hours of group therapy during the week, recreational supports, educational supports within the facility, and case management. And then our placement aftercare workers work to help reintegrate the youth back into the community safely by developing an aftercare plan with each program. We do monitor fidelity to the model. My unit goes out every 2 years. We do a site visit. We had to do that creatively in the last year via Zoom. So we interview youth, staff, we tour the facility, we check notes to make sure that they're following through on the agreed upon contracted delivery of services. Do you have any questions?
We're used to this, throughout the years. So I don't know if anyone. Yes, ma'am.
Chair to Ms. Gibbons. So the children that are, these are children that are in the detention center?
Yeah, most children leave from our detention center and are transported straight from detention to the facility itself.
And so I'm just wondering if this would encompass any of our foster children that are in our care.
Sometimes the court and DCFS will work if if the reason the child is being placed out of the home is a child welfare and juvenile court issue, meaning there's no family for the kid to go back to, but they also have very high criminal behaviors. We will do a joint sharing of costs. So many of the kids can be both child welfare and juvenile court involved. Sometimes the court will take the lead on paying for that if the reason that we're placing them has little to do with neglect, abuse, and dependency and is more to address the criminogenic thinking. It just really depends. So yes, many kids are duly involved in both child welfare and juvenile court.
Could you send my office the number of children
Yeah, we can do that. You want the number of kids sent
that are
to?
in foster care that actually are involved in this? I don't know why I never thought to ask that question.
Anything further? Council President Jones is in attendance. We're discussing 0167. And we're at the question portion. I don't know if you have any questions.
Just one.
Yes, sir.
Through the chair, thank you. You mentioned the recidivism rate. You say 50%?
So based on, we do pull it for each program. That would be not great outcomes, but when you really look at the types of kids, every program takes a different type of kid. They can treat different issues. So some of ours that have a higher recidivism rate, which actually the one, I don't know that we're contracted with them for, that had the highest one was taking our most deep end kids. These were kids that we were diverting away from Ohio Department of Youth Services. So this was a program in Pennsylvania that actually does have it did have a high rate. The other one that has a high recidivism rate is the one that was working with our victims of human trafficking. So we do know that your outcomes for victims of human trafficking and new offenses is going to be really high in comparison to your average population. So we take that sort of with a grain of salt. Yeah, it was Ohio Guidestone, which we're not contracting with for this year. And the other one was Grace Haven. Most of them are between 30 to 40% recidivism.
Okay,
But again, we're
so there's
placing
reasonable explanations as to why the higher rates with
vastly
those.
different
Okay.
kids, yes.
Okay, thank you.
Anything further?
Thank you, Mr. Chairman. Just a general question. And not exactly sure how to word this other than to say, give us a sense of just how effective our residential homes have been. It's a challenging work. You certainly have gotten questions from this committee over the years and others about just our children that we've sent to other states, and it's just a balance between the challenges with the children and our best way of serving them. How would you qualify where we are with this work? And are there any areas of improvement that we should be thinking about?
So I think that the kids that, since we've done a lot of work with increasing our community-based treatment options, I would say that our community-based therapists are working super hard, harder than 10 years ago we worked. They're working with kids with much more serious community safety risks, which means that the kids that we're placing out of the home are that much more serious. If we can manage a kid safely with intensive in-home therapy, which is much more cost-effective, we're going to do that at every corner. So those that are treating kids in residential programs are dealing with profound, complex trauma. Typically, we're talking about early childhood adversities and trauma, early involvement with child welfare. I would say the majority of the programs are doing a really nice job of keeping up with the literature and the research to be trauma-informed. The state has made, and the federal government have made a lot of recommendations to ensure that qualified residential treatment providers are doing trauma-informed care training, which really brings down the number of incidents of use of force, restraints. We do monitor their delivery of services, and we make recommendations from those areas we want them to improve, and all the agencies we've contracted with have been very responsive to those recommendations. I think they're doing a good job. Again, these are the most complicated kids. I think the ones we see with really complex trauma tend to go from one provider to the next, and when they fail out of one program and they move to the next, those are the ones that we see are really hard to dislodge from both child welfare and juvenile court. But those are usually the dually involved youth that have both child welfare and juvenile court involvement.
Thank you. Can I just say this council has proven that it wants to help, wants to support the work that you're doing, and letting us know where those challenges are or things that this body can do. This body's always open to hear those things and consider them.
I appreciate that. Thank you.
Seeing nothing further, and I assume we need this right away, looking at the dates. So if everything's in order, I'll accept a motion on Resolution 2021-0167 to the full council under second reading suspension.
I'll make the motion.
Second.
I hear a motion and a second. Any discussion? All in favor? Aye.
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 Against? Thank you, ladies.
Thank you. Take care.
Miscellaneous business? None? Adjourned.